Hi, I'm Dr. Emily Burns. I'm here at the PRM MSK course, and I'm here with my colleague Fede.
Hi, I'm Federica Lorelli. I'm a doctor from Italy, currently rehab training, and I'm doing a clinical attachment in Sheffield Spinal Unit, and I'm here for the MSK course.
So how have you been finding the MSK course so far?
Oh, it's been great, actually. It has exceeded my expectations. As I said, I'm in Sheffield actually right now, and my consultants told me about this opportunity, so I'm so happy to be here, and it has been really useful because it covered like the topics that I expected to be covered, but it also has some nice different things like nerve blocks and things like that. So I'm really liking it.
Yeah. And when we were talking earlier, you noticed the rheumatology was something that's not something you've experienced as much in your training.
Yeah.
And that was helpful to have that talk, I think you said.
Yeah, it was very helpful actually.
Great.
Yes.
Yeah. And that brings us on to talking about our training. So I'm a trainee in the UK and you're training in Italy.
Yeah.
We talked about some differences. Could you maybe share a bit about those?
Yes. The medical education is really different because we do 6 years of medical school. Then we sit for an exam. We get ranked, and based on that ranking, we decide which specialty training we want to take, and we go straight into specialty training. So it's for rehab, for example, is 4 years, and I'm in my final year of rehab training. And I've also learned that the training program is quite different because, for example, in my city, but it can be different in different cities in Italy, we have the first 2 years of rotation every 3 to 4 months in MSK, stroke rehab, and that's pretty much it. We have also like some cardio and like respiratory rehab, and then that's for the first 2 years, yes. And third year we have spinal cord injuries, neuro rehab, and some more stroke and MSK, just a mix of that. So not really rheumatology, as I said. And during our final year, we can decide what we want to concentrate our energies into.
So there's a lot of similarities in our training pathway. It's 4 years as well, but it was quite surprising that you go straight from medical school. So you made that decision to become a rehab medic from medical school, whereas we do a initial pathway. And in the UK, it's quite broad, which route you can come through. So anything from psychiatry, GP, surgery, and a lot of internal medicine, which is the route I came through. And you do that for 2 or 3 years after having done foundation training. So foundation training, then IMT, and then into rehab medicine. So it's quite a difference.
Yes.
What about the remit of rehab medicine in Italy? So the BSPRM here there's a lot of conversations and work to expand our reach, because we know that so many patient groups could really benefit from our holistic combined with interventional, that kind of rehab approach. Do you think that there's similarity in Italy, or is it already quite broad?
No, I think that it's quite similar. People are starting to understand that rehab really works and it is helpful, and we can do a lot of things. It's not just physiotherapy, you know. So people are starting to get interested into nerve blocks, as I said, and sports medicine. So we're growing, I hope. And this is actually one of the reasons why I chose rehab, because it gives you the opportunity to explore a lot of things. And I feel that that is really important in our profession, just not to focus on only one thing, you know, and keeping contact with other professionals.
Yeah, absolutely. And we talked about some of the subspecialties that we have in the UK training. So we have a block where we do amputee medicine, and that was something that's not automatically within your training.
Yeah,
not
in my city. Yeah, I don't know about other cities in Italy, but we don't have a dedicated amputee clinic. So that could be implemented for sure, but we might get a chance to see some amputee patients, but I've only seen like 3 or 4 in
You
my
have to come to Norwich. We have an amputee inpatient unit.
Yeah, can't wait. Yeah.
So we can arrange that. One thing that has happened recently in rehab medicine in the UK is that the BSPRM worked with the government to assign rehab medicine to the long COVID syndromes. So now rehabilitation medicine leads on that and has set up a society to bring together professionals working on that. Has anything like that happened in Italy? Do you know who looks after the sort of long COVID population?
I don't really know if there's a pathway established.
Yeah. I think that's
actually, so it could be useful for rehab physicians to look into that, because as you said, we have this holistic approach. So
we're used to dysautonomias and multi-system, and then that process of rehabilitation requiring the MDT. So it's a really good example of where rehab medicine has the right kind of approach to
I agree completely.
Yeah.